Medurstand-Understanding Medicine.
Professor Aziz Rehman from Medurstand. Today I am going to demonstrate to you how to test fifth cranial nerve, that is also called trigeminal nerve. So like all nerves, we have two, one on each side, and this trigeminal nerve have got motor functions as well as sensory functions. It supplies the entire half of the face, provides all types of sensation, and also supplies the cornea, which is very sensitive structure, and that provides the basis of corneal reflex. Then it also transmits the taste fibers some part of the tongue. So this is the sensory part, and the motor part, it supplies these temporal muscles, muscles of mastication, these muscles, and muscles which move the jaw. So that is the motor function. And finally we would also demonstrate the jaw jerk, which may be positive in some patients, particularly the upper motor neuron lesion bilaterally, very rare cases. So let's get started. First of all, let me check the sensory part. I think the technique of checking sensation is the same. I'll just use this tissue paper and I'll test on the both sides, from the forehead and downward. ये पता चल रहा है आपको?
जी सर।
ये पता चल रहा है?
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 जी सर।
All right. So his sensations on the face are intact. This part is, there are the various parts. This is ophthalmic part, ophthalmic division of fifth cranial nerves. Then we have maxillary division, then we have mandibular, and there are some cervical branches also. So we can test all of these on both sides. So the sensations are intact. Now let me now show you how to test the corneal reflex. You know, corneal reflex is very important reflex, because this is one of those reflexes which are the last ones to go. Now if you are dealing with a patient who is very serious and you have to decide whether there is any evidence of brain death or not, we do this test. And I think I will just demonstrate you the method. I will not actually do it. So what we do is, and we have to touch the cornea, but very important that you have to touch the cornea, the peripheral part, because if I touch the central part and if accidentally I damage his cornea, that could lead to visual loss. So accidents do happen in life, so we have to be very careful. We examine the cornea and we bring this cotton wool or tissue paper from the side so that patient doesn't see it. Why? Because if patient can see something coming toward his eyes, reflexively he will close his eyes. So when we touch the cornea from the side, there will be reflex contraction of the muscles of the eyelid, and there will be sudden and brisk closure of the eye. So this is how I do it. आँखें खोलें ज़रा, आँखें खोलें. So like this. So there was contraction of eyelids, sudden closure of eye, palpebral fissure from this side, like this. So this is the corneal reflex. I told you we do not do it on the bedside, but only when patient is comatose and we want to make sure that the brain is not dead. If corneal reflex is present, we feel assured that the brain is still alive. Now finally, I am going to demonstrate you the power, the motor part, the sensory part, the taste I am going to skip. The motor part, ये ऐसे ज़ोर से ऐसे करें ना, दबाएं, ऐसे दबाएं, ऐसे. So I can feel the muscle, temporal muscle contracting. ऐसे ज़ोर से ये. So I can see the muscle of mastication contracting. jaw ऐसे आगे करें, बाहर इधर को ऐसे, पीछे, side to side ऐसे, ऐसे मेरी तरफ देखें, move करें, कभी उधर को कभी इधर को. So his jaw movement is intact. The contraction of the jaw is very forceful, equivalent. So motor functions are intact. So now finally the reflex, jaw jerk. I think we have to be very gentle in this test. Number one, it is not done routinely. It is done only when we are to differentiate between bulbar palsy and pseudobulbar palsy. In other words, we have to differentiate between lower motor neuron and the upper motor neuron lesion. You know, in upper motor neuron lesion, the reflex is likely to be exaggerated. So we ask the patient to open the mouth halfway, no, itna nahi, darmiyana sa, और ज़ुबान अंदर रखनी है. So we have to instruct the patient to keep tongue inside, and I think we can see the contraction and we can also feel it. The way I do is put my hand here so that when these muscles contract, I can feel them and I can also see it from here. मुँह खोलें थोड़ा सा ऐसे, and I will put my thumb here and I will strike this hammer on my thumb. Like this. In normal healthy people, this reflex is barely elicitable. Only in people with bilateral upper motor neuron lesion, which is pseudobulbar palsy, in that there may be exaggeration of this reflex and there may be brisk closure of the mandible and the mouth. So that is positive reflex. So that constitutes all the fifth cranial nerve, all the features. So we did sensations, we did motor function, we did corneal reflex, and we did jaw jerk. Thank you.